Welcome to this predicted paper from Psychology Ninjas. This paper represents the best guess for the upcoming exams. Please use this paper in addition to your other revision. You can complete a unique version of this paper by going to our Psychology Ninjas site. Psychology Ninjas is full of free content to help you with your exams. You can save your scores with a free account. Outline the interactionist approach to treating schizophrenia. Here we have the command word outline, which means we need to give a detailed description. There's some assumed psychological knowledge here in our understanding of an interactionist approach. This focuses on the combination between nature and nurture. This question is also just looking at treatments rather than anything else. As the command word is outline, all of our 2 marks are about our knowledge of the interactionist treatments to schizophrenia. Let's have a look at a response. Interactionism looks to treat schizophrenia by combining antipsychotics with CBTP, so that an individual is rational enough to engage with identifying and challenging irrational thought processes and homework. We've identified within our response that this is a combination of biological and non-biological treatments. You could do other forms of non-biological treatments here, and we've explained what the process is and why this is useful in terms of making people rational enough to engage with those non-biological therapies. Outline and briefly evaluate cognitive behavioural therapy as a treatment for schizophrenia, 4 marks. Although this is a short mark question, we've actually got 2 different command words. The first one is outline, and we need to give a description or an explanation of cognitive behavioural therapy. There are 2 marks available for our AO1 or our knowledge of this particular therapy. We also need to give a brief evaluation, and so our AO3 is also going to be worth 2 marks. We need to make sure we're balanced and doing both of these to maximise the marks available. Let's break down a response. CBT has been adapted into cognitive behavioural therapy for psychosis. This works by correcting the distorted beliefs that influence their feelings, causing maladaptive behaviour. Thought processes are challenged in order to give more rational responses and behaviours to the symptoms experienced. This response identifies CBTP, although you wouldn't have to do this in order to access marks. We've identified that the purpose of this is to correct our thought processes and to create more rational responses, so therefore our behaviours are more rational. With our detailed, thorough explanation or outline, we can then move on to our evaluation. The effectiveness of CBT is limited by its lack of availability, with only 1 in 10 of people in the UK who could potentially benefit from it getting access to it. Its lack of availability is not a procedural fault of CBTP, as research has shown it to be effective in improving the prognosis of schizophrenic individuals. Here we've talked about the fact that it's limited in terms of its availability, giving specific data. We've also identified that it could be effective. You could talk about this with specific research in order to get your 2 marks as well. Skylar has been given a recent diagnosis of schizophrenia following several months of believing that certain TV shows were sending her secret messages. Skylar has since stopped going to several activities that she enjoys and doesn't answer the phone when friends ring. Skylar's maternal grandfather also had schizophrenia, but neither her mother or brother have shown any symptoms. To what extent would a biological explanation other than neurotransmitters explain Skylar's symptoms of schizophrenia? 8 marks. Here we have the command word to what extent, which means we need to explain and evaluate. We're being asked to explain a biological explanation other than neurotransmitters, which means we need to look at a genetic explanation for schizophrenia. We get 3 marks for explaining our genetic explanation. Normally that would mean that there was 5 marks available for explanation. However, this has a STEM, and so we're only going to have 3 marks for evaluation and 2 marks for our knowledge linked into Skylar's symptoms. So we need to be aware here that we need to do some application into Skylar and the information we've been given in the STEM. Our first job is to explain a genetic explanation for schizophrenia. Genetic explanations for schizophrenia suggest that genetic variations may be responsible for irregularities in neurotransmitters. Hilker et al. Found 79% heritability for schizophrenia, demonstrating genes have a significant role in this disorder. We've identified our alternative by talking about genetic variations. We've also identified research that talks about heritability, the likelihood that genes are responsible for schizophrenia. It's now time to link this into the STEM. Skylar has a family history of schizophrenia, with her maternal grandfather also having the disorder, so his genetic variant may have been passed down to Skylar. It's not enough just to use the person's name. We need details from the STEM in terms of the maternal grandfather also having schizophrenia. We're going to highlight this in our STEM in order to show that we're using different parts of the STEM and illustrating application skills. Now it's time to evaluate. Research supports the role of genetics in schizophrenia, comparing the concordance rates of MZ and DZ twins. We've identified twin studies in order to show how we are assessing genetic explanations. Concordance rates are the percentage of times that twin A and twin B have the same clinical diagnosis. We're then going to explain specific research findings. Gottsman and Shields found that concordance rates for schizophrenia were 42% for MZ twins compared to 9% for DZ twins, with higher correlations for our genetically identical twins, showing the influence of genetics in the disorder. We've identified both specific research findings here, but the impact of them and why genetics is responsible for schizophrenia. We're going to develop our evaluation by giving a counter-argument. However, twin studies are problematic as similarity may be due to their shared environment and identity confusion rather than genetics. The equal environment assumption reduces the validity of twin studies and, as a consequence, the accuracy of genetic explanations. We've identified a clear problem with the methodology being used to evaluate genetic explanations. We're going to complete our evaluation by giving a statement. Genetic explanations are only part of the explanation for Skylar's behaviour, especially since her mum and brother do not show symptoms of schizophrenia. Again, we're showing off our application skills by linking this back into the STEM. We're going to highlight this in the STEM, again to show breadth of our evaluative skills. Let's return to our explanation once again. Right indicates that 700 genetic variants may be linked to schizophrenia, with some genetic mutations occurring spontaneously without a family history of the disorder. Genetic mutations may occur due to environmental influences or an error during cell division. We've given a breadth of knowledge in terms of genetic variants and how these might occur. It's important that we show a variety of knowledge in order to get detailed and thorough explanation marks. Let's return to application once again. As there is no family history prior to Skylar's maternal grandfather having schizophrenia, it may be that her grandfather was an immigrant, which created a stressor that caused the genetic mutation. Again, we focused on the maternal grandfather. We want to be careful not to go too far beyond the STEM and give a whole backstory that isn't actually there. Let's return to evaluation once again. Genetic explanations are based on correlational methods, limiting their validity. We've identified here that concordance rates are basically correlations and therefore may not be accurate. If schizophrenia was only explained by genes, then concordance rates for MZ twins would be 100%. Therefore, social adversity or recreational drugs may contribute to whether an individual displays schizophrenic symptoms or not. It's really important here that we identify the problem with this particular method, and that if it was just genetics, we should have concordance rates of 100%. We've also given some different ideas which might be a cause for schizophrenia. We're going to explore this in more detail. Furthermore, Tainari et al. Found that although a biological parent with schizophrenia did mean that more adoptees were diagnosed with schizophrenia than controls, 9% compared to 1%, diagnosis only occurred when the adopted family were classified as severely disturbed. We've identified research here and explained why these might be problematic in terms of findings for schizophrenia. Let's form a judgment to complete our discussion. Adoption studies support an interactionist approach that genetic explanations are only a component of schizophrenia. We've demonstrated here our wider psychological knowledge in that an interactionist approach or a combination of genetics and non-biological factors may be the best explanation. Let's return one more time to our outline of genetic explanations. Individuals with a DISC1 variant are 1.4 times more likely to develop schizophrenia, as it codes for the creation of GABA, which regulates glutamate and dopamine in the limbic system. Here, our knowledge of specific genetic variants demonstrates our understanding of schizophrenia. We've identified why these are problematic and what impact they have on neural mechanisms. We're then going to link this into our application to Skylar. A dysregulation of dopamine due to DISC1 may explain Skylar's negative symptoms, as she has stopped going to several activities that she enjoys and doesn't answer the phone when friends ring. Here we've identified specific symptoms experienced by Skylar and that these are negative symptoms or an underfunctioning of normal activities. We're going to highlight this in the STEM in order to show that we've used different variations and show our understanding of application. We're going to evaluate one more time. Research supports the role of DISC1 in explaining schizophrenia. We're then going to explain specific research. Dayon et al. Conducted a meta-review of 14 studies, finding that DISC1 is associated with presynaptic dopamine dysregulation, showing external reliability of genetic explanations. We've identified specific research and the implications of this in terms of understanding genetic explanations for schizophrenia. The role of different genetic variants shows that psychological knowledge of schizophrenia has developed over time, with the role of additional variants continuing to be explored since the completion of the Genome Project. We've been clear how this knowledge is continuing to develop, showing the impact of genetic explanations. And let's complete this with a judgment. The cumulative body of knowledge on the role of epigenetics demonstrates the impact psychological knowledge can have on understanding clinical conditions. Here we've identified the cumulative nature of psychological research, that studies build on previous research in order to give a more holistic and more complete picture. Let's complete our response with some concluding remarks. There is external reliability with a range of evidence from twin studies and correlations that supports the role of genetic explanations. Reliance on correlational methods makes it difficult to establish whether genetic variants are the cause or consequence of schizophrenia. And finally, the role of social factors demonstrates the need to consider a diathesis stress model to explain schizophrenia. Explain the impact of culture in diagnosing schizophrenia. 2 marks. Here we have the command word explain, which means we need to give a detailed description. The focus of this question is culture and diagnosis, and so both of our AO1 marks need to focus on how culture might change who or how often schizophrenia is diagnosed. Let's break down an answer. The process of diagnosis is more likely in particular cultures, as the creation of new words is encouraged. In Rastafarian culture, the creation of new words is encouraged and celebrated, but clinicians may view this as word salad or disorganised speech. We've focused on why this might be a problem in terms of neologism and the encouragement of this in Rastafarian culture, which then makes these people more likely, or this culture more likely, to be diagnosed. Assess drug therapy as a treatment for schizophrenia. 8 marks. Here we have the command word assess, which means we need to do 2 separate skills, the first being explaining or outlining drug therapies. There are 3 marks available for our explanation of how drug therapies work and what drug therapies we would use to treat schizophrenia. Our remaining marks are all evaluation, so we want strengths and weaknesses of drug therapies using DESERT as our acronym. Let's break down a response. Typical antipsychotics act as dopamine antagonists, attempting to reduce dopamine activity. They block dopamine receptors on the postsynaptic neurons, meaning that less dopamine is transmitted across the synapse. Drugs such as chlorpromazine also have a sedative effect, meaning that they could calm patients down and reduce anxiety. We've identified a particular type of drug therapy that could be used with schizophrenics and explained how it has an impact on mode of action. Although you wouldn't have to necessarily identify specific drugs, we have here in our explanation. Now let's get into evaluation. We want more evaluation than explanation given the allocation of marks available. Due to expert power, the opinion of clinicians is respected and their directions for treatments is followed by patients. Here we've identified the directiveness and the use of expert power by clinicians in order to administer and deliver drug therapies. We then want to explain the impact of this. Clinicians have the power to determine the dosage of chemotherapies and which medication an individual should be put on. Clinicians also have the power to diagnose someone with a disorder or not, and therefore impact whether they have access to treatment at all. The dosage of the medication, the nature of what medication it is, and whether medication is needed at all is all within the power of the clinician. In order to develop our evaluation and discussion, we then want to give a counter-argument. Because we've started with a negative, we're going to go for a positive here. However, the patient remains autonomous in whether they comply with their medication. It will be up to the individual whether they regularly take their medication after leaving hospital, although compliance can be forced if an individual is believed to be at risk to themselves or others under the Mental Health Act. Compliance with medication is going to be the thing that is limiting the directiveness of this particular therapy. At some point, it's going to be up to the individual with schizophrenia about whether they comply and take their medication. We're going to come to a judgment to complete our evaluation. Those with psychological knowledge must recognise their power and their own biases so that they are recognised and reduced so as not to affect the validity of treatment. We've clearly explained the impact of this in the accuracy of the treatment, which might be affected by our own expert power. Let's return to our explanation of drug therapies. Atypical antipsychotics were developed as an attempt to find drugs with fewer side effects than typical antipsychotics. Clozapine acts in a similar way to chlorpromazine, but also acts on serotonin and glutamate receptors. The effect of this, as well as reducing positive symptoms, the reduction of depression and anxiety, and the enhancement of mood. Here we've talked about atypical antipsychotics. Instead, sometimes these are called second-generation antipsychotics, and typicals are called conventional antipsychotics. So lots of different terminology, all for the same thing. We've shown how they have a different mode of action, acting on different neurotransmitters. We've also seen the impact of this in terms of reducing both positive and negative symptoms. Let's dive into evaluation once again. Biological therapies have been successful in treating schizophrenia, where drug therapies are taken to reduce and are given to control the symptoms of patients. This evaluation is all about the effectiveness of drug therapies as a treatment, and so is going to require some research. Let's develop our explanation by giving some research. Zhao et al. Found that 17 of the antipsychotics tested had a significantly lower relapse rate than placebos, suggesting that drug treatments are a viable alternative to the high financial costs and social isolation of hospitalisation. Our explanation on effectiveness has focused on Zhao et al.'s research. However, you can use lots of other different pieces of research. You want to focus on a lower relapse rate, so less people getting schizophrenia again, and comparing that to placebos where no actual drug was given. We're then going to give some counter-arguments showing that actually drug therapies may not be as effective. However, Ross and Reed found that a placebo can also be beneficial without changing the neurochemistry of an individual. They found that 45% of participants did benefit from a placebo, and of the 81% who benefited from the drug, 45% would also benefit from the placebo. Our counter-argument has focused on research from Ross and Reed, suggesting that placebos might be beneficial for both people who did benefit from the placebo and those who benefited from the drug. Let's complete this assessment with another mini-judgment. Although drug therapies have been effective in reducing symptoms, they are reductionists and do not take into account the impact of environmental factors that may have an impact on the likelihood of relapse. Our conclusion focuses on the reductionist element of these particular therapies, in the fact that they're only treating the symptoms rather than the causes. Let's return to our outline or our explanation of drug therapies. Risperidone is another atypical antipsychotic and is designed to be as effective as clozapine without the risky side effects. It binds to dopamine receptors more strongly than clozapine, and there is some evidence that it produces fewer side effects. Here we've talked about the benefit of a different drug type and explained its mode of action. We're going to evaluate once again, this time focusing on side effects. Antipsychotic drugs are weakened by the fact that they have severe side effects. We've clearly identified this as a negative for the use of drug therapies to treat schizophrenia. We then want to explain some specific side effects for antipsychotics. There have been large out-of-court settlements due to the side effects of conventional antipsychotics. One side effect is tardive dyskinesia, the uncontrollable movements of the lips, tongue, hands, face and feet, which affects 30% of patients, with 75% being irreversible. Our big side effect for antipsychotics is tardive dyskinesia, and we've explained the impact of this and the prevalence in order to show its impact on this as a treatment. We're going to develop the impact of side effects further. Furthermore, using medication reinforces the notion that something is wrong with you, and therefore individuals do not think about possible stressors and reducing the motivation to look for solutions. The use of CBTP has been effective in treating schizophrenia, with NICE finding that it was effective in reducing rehospitalisation rates up to 18 months after treatment. We've discussed the impact by suggesting that by using drug therapies, we lose motivation for looking at other solutions. We've also identified CBTP as an alternative to drug therapies. It's time to complete our discussion by looking at another judgment. In just treating the symptoms of disorders, drug therapies may be limited in their effectiveness and fails to prevent a relapse in symptoms. We've clearly discussed the limitations of this and that it might prevent relapse, so as soon as we stop taking the drug therapies, the symptoms might return. Let's complete our response with some concluding remarks. The ability to change behaviour using biological psychology can be abused, as those with power decide the dosage and drug therapies received. There are limitations on the effectiveness of antipsychotics, suggesting that they are not the sole treatment for schizophrenia, and suggest that neural explanations lack validity. And finally, significant and lasting side effects of antipsychotics have resulted in the use of an interactionist approach for the long-term care of schizophrenia. You can complete a unique version of this paper by going to our Psychology Ninjas site. Psychology Ninjas is full of free content to help you with your exams. You can save your scores with a free account.